Hi everyone, welcome back. This is Dr. Sumit Grover. You can call me Sumit by my first name, a licensed clinical psychologist of New York State, United States of America, and a HCPC registered chartered psychologist for United Kingdom. Firstly, thank you very much for throwing questions over me and giving me feedback for my last two recordings. The one, love versus relationship, was a very challenging one, and I enjoyed answering your questions. Today's topic is as promised in my previous videos and continuation to the borderline personality disorder, part 1, the diagnosis. Firstly, I would like to say that this video is not a substitute for clinical care. It is just for educational basis. So please follow the mental health care protocols and seek guidance on the basis of specific case. Any personality disorder we have to diagnose following the criteria from Diagnostic Statistical Manual 5, DSM-5 for ICD-10. We as clinical psychologists cannot diagnose any kind of personality disorders without meeting the specific criteria according to the above mentioned manuals. So according to the classification, the key symptoms of borderline personality disorder and to meet the criteria to be diagnosed with personality disorder, it reminds me of a very interesting song, Save Me From Me, Leave Me, I'm not sure if you need me, so don't cry over me by Kare Bostani, because it perfectly fits into a borderline personality disorder. The reason it follows the triangle between numerous rejections to insecurity leading to fear of abandonment. Abandonment can be imagined or in reality. Usually, the onset of borderline personality disorder is age 18 and above, and it carries on till 30s. It also can be termed as because the emotional intelligence and emotional maturity it becomes pretty better at 30s or 40s. If you've heard, oh my God, she is so vulnerable, she's a drama queen, unpredictable, impulsive, reckless, angry, and often audacious, I'm sure you're talking about borderline personality disorder. Way back, according to the psychoanalyst theory, they belong to a borderline. They said the borderline personality disorder belongs to a borderline of neurosis and psychosis. Neurosis is anxiety, affective, emotional, and mood disorders. They all come under the bracket of neurosis. And psychosis is delusional. Out here, mainly when we talk of psychosis, they are delusional about their relationship and paranoid of being abandoned. The predisposing case formulation of this disorder, the base is usually a dysfunctional family or neglected or abandonment from one of the parents or both the parents, turning into a wild child, becoming reckless into decision making, multiple relations, one after the other, impulsive behavior, drug use, volatile, or getting into sexual relationships quick. And I had been treating regular patients with borderline personality disorder since past 15 years of my practice, and many case studies can be discussed in the next talk, which I will do in borderline part 2. But this time we'll stick to diagnosis. But what I have learned from these case studies and experiences, and I have researched that for them, instability is the word. Unstable and unstable relationships, unstable emotions, behavior, impulsiveness, lack of sustaining any of the things what I have mentioned above. And lack of maintaining and sustaining relationships is one of the big ones. Behavior, thoughts, sense of self, unstable or instability in the sense of self. Self identity is also one of the big symptoms of borderline personality disorder. It's more when we come to relationship. I love you in the morning and I hate you with being vindictive in the evening. It's a specific trait of borderline personality disorder. They can idealize someone so high and it's all about them, and then they can devalue the same person quick. The relationships are always unstable. They start with a very passionate way, intense, want to meet that person day and night, want to be together, and they cut off themselves from complete other social and family life and other relationships. It's so intense. Will go out of the way to do anything for the person they love. A minor cut or a treat or a threat to the person whom they love, they will treat it as a big thing because they are so possessive and obsessed with their lover. And they're on the roller coaster and they'll carry the person with them. But suddenly, one thing goes wrong, and boom, the relation is done and ends with intense anger, very angry. As far as empathy is concerned, either they will feel a lot, very sensitive, over identifying themselves with the person like just an acquaintance and would like to attend their wedding and shower, and meaning thereby that for them the relationship has no boundaries. Empathy has no boundaries. They will be sensitive at one point and very insensitive to the other point. For example, they will shower their everything, money, things over them. And then when it comes to no empathy, they won't even care or bother or talk to them for days together, even if they're saying, oh, we are sick. Even after ending the relation, the delusion part starts as the other person is not counting a relationship and counting as a relationship has ended. But the person with borderline personality disorder, BPD in short, will carry on the relationship and name the relationship. It's to the point, I'm talking about social relationships too. A friend may become a sister, an uncle becomes a godfather, and acquaintance becomes a best friend. And this all is one sided. They carry on and they carry on and they stretch it. The other person, after ending relation, is happy in their own life. They've moved on. But still, the person with BPT will hang on to the person, and suddenly Valentine's Day will come after 1 year of breakup, and they will try to come back. They'll scroll back and contact by wishing the other person Happy Valentine's Day and start planning when and where they can meet for a date. Totally delusion about the relationship that it's ending. When it comes to instability of emotions, including impulsiveness, acting out, and not thinking before their actions, we often confuse bipolar disorder with borderline personality disorder. Rather, we sometimes also use the word bipolar personality because of no emotional regulation. There is no word as bipolar personality. It is bipolar disorder. The difference between both of them is that in case of bipolar disorder, they have to have manic 7 days or more than that. That is which the person is impulsive, like no sleep, talk, talk all the time, high of the roof plans, spending all the money buying properties and various other investments. And then after 7 days, in case of bipolar 1, they are depressed, sad, and never okay, never in between. Bipolar, it carries on for days together. But in case with BPT disorder, in the morning you are happy, happy, finding a happiness from craving or for being loved is the main focus and being accepted. And by the time it's evening, it's sad or angry, as the person always tries to find happiness from the other person. They never try to find happiness within themselves. They keep craving for a relationship and for love all the time. So always from one end, woof, to another, whether it's behavior or emotions. The difference between impulsiveness, as from bipolar, is that in case of BPD, it is attached with vindictiveness to the point that they can cause hurt or put the person into trouble even when they say or declare they love badly, because even if they're perceiving or imagining abandonment is coming. So with them, they imagine, oh, it's coming. It's abandonment. Oh, she's going to ghost over me. Oh, he's going to ghost over me. It's coming. And she's going to leave me. Oh my God, don't leave me. So sometimes, without even discussing why the other person did not come to meet or replied back to the text, or if something actually has happened to the person, they will assume that he or she have been abandoned and ghosted, and they'll conclude, I have to teach them a lesson. And during the time in impulsiveness, they can either self harm themselves by cutting or making a suicide attempt or planning it, or even harm the other person. For example, in many of my patients' cases, which I have come across, social media, they will leak out their sexual talks in public to teach them a lesson out of their insecurity. They almost perceive that the person is already with someone else and gone. So, self harming can be attached with the thought process that I am under emotional pain and I have to release my pain by causing physical pain by cutting myself, even though I don't want to kill myself. But I am going to give this pain to my lover, that if you leave me, I will end my life. They want to achieve the person so badly and want to get them so that it is why it is also seductiveness. Seductiveness is one another important trait of borderline personality disorder. I will discuss in the next couple of sessions how seductiveness can lead to obsession too, and to achieve a person can lead to various relationships. Another important trait of BPD, borderline personality, is that they don't have any sense of self. The self identity part is missing. They're seeking approval all the time. And many times, patients even come and ask, who am I? Who am I, Dr. Grover? And And to answer this question, they will change their name, they will change their hairstyle, have tattoos over the body, and they can even have negative body image issues. That is why, where the eating disorder enters, most of the people with BPD do have eating disorder, and they will bring about changes in their body figure, and because they, as I mentioned in my last video, because they really want to be with the person. So they diffuse their self identity and personality the way the other person wants them to be. So, lack of self identity is hinged onto seductiveness or crave to achieve the other person too. The crave and longing to be loved or to be with the other person, to fall in love, is so strong, and the relations don't work and cannot be maintained, as if they don't have the ability to maintain the relationship. They're always living with emptiness, with the voidness. Even when they're in a relation, they don't feel loved. They'll keep asking the same question to the other person. Do you love me? Do you love me? Give me evidence that you love me. No, you don't love me. You're going to leave me, right? The reason? Because once again, for imagined and perceived abandonment coming and insecurity, they have mistrust issues too. And with feelings of emptiness, their happiness is dependent on the relationship on the other person. To fill in that void of emptiness, that can also lead to eating disorder or binge eating. So, borderline personality disorder can be very confused with bipolar disorder, eating disorder, schizophrenia, or paranoid psychosis. And the suicide attempts can also confuse with severe depression to the level of ending their life. And also, this suicide attempt or impulsiveness to self harm can also lead to a serious problem and issue, because sometimes they don't want to end their life, but cutting can lead to infections. And the treatment is, of course, to support the patient to through dialective behavior therapy is one of them, a very researched and practiced to match and to fit to cause mindfulness and radical acceptance of the past, and mindfulness techniques to be followed to stabilize the person's emotions, behavior, and to come out of self harming or that reckless, impulsive behavior and become more rational as far as emotions are concerned. This dialectic behavior therapy was introduced fitting on the basis of the etiology and the symptoms of borderline personality disorder, which we are going to discuss in part two. How we can treat with case studies of my experience with the patients well. But today we have covered the part of the diagnosis and symptoms of borderline personality disorder. So once again, I will say, throw questions over me, contact me below my page of YouTube. You do have the email ID. Things can be kept confidential, and of course, surely I will answer back as I had been doing, and we will discuss further in part two about treatment and how to support the patient or person with BPD, borderline personality disorder. It was great to do this piece of recording for you people, and I will come across you soon. Till then, have a good day, have a good life, and still fall in love and be in relationship. Thank you. Thank you for being here and listening to me.